People actually can lower their costs of healthcare by joining my practice. I see it as two people meeting their needs, economic needs. So I want to provide a better care that I was trained to do and continue to train and really try to do that. I do a lot of independent study and you know, kind of pursue what's the latest that really fixes people's problems. It's the economics for me is I don't have to see whatever number of patients that has to continue to grow in order to keep everything rolling. Well, now I can provide something so they don't have to spend time on the internet necessarily, or it can be directed how I would really recommend or whatever. So whatever that person you're struggling with, you get the answers you want and the time that you really want the doctor to spend on your issue. So he can't spend it on 10 other people in that hour and you be really happy. But if you're that only patient that hour, well, you get, I think, a whole lot that you never knew you could get from a physician relationship. Probably the most obvious is I won't look like I have ants in my pants when I'm seeing folks. I try not to appear that way, but it does. I feel that way, and there are a lot of pressures in medicine. It's largely, it's not the patients or their problems or the phone calls you want to make to someone sick. It's really the paperwork and the mounds of administrative stuff, or it's feeling like you just have to keep seeing more and more, and so that it just leaves less time to really solve each problem or teach what you really want to teach or hear what they want to say or what have you. I feel like I leave every room something unanswered, or I leave, it's not wrapped up. There's not a bow on it, and I think that patients appreciate my time and they know that it's tough. So I want to deliver to what they really want, what they need, what they deserve. Nurses aren't returning patients' calls because they're dealing with mounds of paperwork, or they're on a 25-minute phone call with an insurance company, and they'd rather be taking just patient calls. I will be considered out of network for insurance companies. So it can be something that you can file yourself, and for catastrophic coverage or what have you. Of course, our goal is to keep you from having those catastrophes, heart disease, cancer, whatever, breakdowns, whatever the case may be. We want you healthy and never really require care.